Hey everybody, today I want to talk to you about coughs and colds. So what's a cold? It's an upper respiratory tract infection. So just an infection of your nose and your throat with a virus. That's it. Your sinus and your lungs are not infected. No bacteria. So as with anything, there are exceptions. For instance, if your child has a cough and cold and an underlying medical condition, there's a chance I'll ask you to come into the office. If your child has asthma, even if they're not wheezing, even if they're not using their inhaler more, I still want you to text me. I want you to reach out to me. I don't want you to rely on Dr. Google in and of itself. For instance, I might ask you to bring your child into the office so I can listen to them. Another exception is a baby of 6 weeks or less that has a cough and cold. Even if there's no fever, I will also almost always ask you to come into the office. If a child of any age has a fever for 4 days with a cough and cold, please come into my office. So even with coughs and colds, there could be times to really worry. There are times to call 911 or take your child to the ER. For instance, if they're breathing really fast, if you see ribs, which are visible, if they're not responsive or in a lot of pain, that's what you should do. Aside from that, for a cough and cold, just rest, hydration, and Tylenol. That's the ticket. But if you're worried, please text us, message us, call us. Don't just Google it. Because at LittleWell Pediatrics, we've got you.